Okay, respected seniors and my dear colleagues, today is the second day of Disability Awareness Week. Yesterday, our state president, Dr. Narayan sir, inaugurated the week IAP Cochin also the program. Today, we have two speakers for CME, Dr. Maya Rose Vinod, and developmental pediatrician, NAPMR, and Dr. Susan Mary Zakaria, developmental pediatrician, as her names. Before that, we have another small program to felicitate our CIP President-elect Dr. Ramesh Kumar sir, and Dr. Venugopal sir is our senior member who won the Best Family Vision Award of IMA, and we have a small program to felicitate them. And here my duty is to welcome all. First of all, I like to welcome Dr. Ramesh Kumar sir, our President-elect, CIP President-elect, and then I welcome Dr. Narayan sir, the President, IAP Kerala, and Dr. Raman Balendra sir, President, Secretary IAP Kerala, and I welcome all of you to this program. Now I invite Dr. Narayan sir to address the meeting. Yes,
Yeah. Good evening to you all. Respected President of IAP Malappuram, Dr. Akbar Sadiq, senior pediatricians, and my dear friends. All of us in the IAP family were very happy to hear the news that Dr. P.P. Venugopal, a senior-most pediatrician from Perindalmanna, was chosen for the Best Family Doctor Award by IMA CGP. Everyone who knows him will agree that he is the right choice for this prestigious award. An astute clinician with excellent communication skills, a multifaceted personality actively involved in not only in medical profession, also extra medical fields like cinema, hobbies, and a doctor with social commitment. He is an all-rounder, blending profession and creativity. And above all, a wonderful human being. Sir is a model for the young doctors of this generation to emulate. IAP Kerala congratulates him and wish Sir many more years of happiness and peace. Congratulations, sir.
Thank you. Thank you.
Another dignitary who is to be congratulated is our CIAP President-elect 21, Dr. Ramesh Kumar. But I have been congratulating him from the 1st of November until the 30th of November. So again, I extend warm greetings, congratulations, and best wishes to you, Dr. Ramesh. Today, as Akbar has put it, today is the second day of Disability Awareness Week. As I have told yesterday, our duty is to diagnose and pick up disabilities at the earliest and start early intervention treatment. So we have to plan in such a way that, especially for Malappuram district, where there are a lot of private hospitals as well as well-run government machinery, IAP Malappuram branch should act as a point of contact to coordinate child development activities in the district early intervention center and in the government sector as well as in the private sector. Dr. Pisharadi is the chairman of Neurodevelopmental Chapter of IAP Kerala. It is his vision that IAP should take lead role in coordinating the child development activities in every district through the IAP branches of that particular district. So I request the Malappuram branch to have a meeting with the RCH officer, with the DPM, with the coordinator of ASHA, CDPO, and all the people involved in child development. So there should not be a, private, and there must be a good participation and association between the private takers and the government machinery, so that at the peripheral level itself, we will be able to detect disability at the earliest and start early intervention, which unfortunately has not come up to our expectation. So that's our action plan, coordinating child development activities at the district level through IAP. So I request to make this program a project, one of our action plan, a success. And we have 2 young ladies performing today, and I wish them all the best. Thank you.
Now I invite Dr. Balachandran, Secretary IAP Kerala, to felicitate.
Respected President of IAP Malappuram, Dr. Akbar Sadiq, or State President Dr. Narayan, or National President-elect 2021 Dr. Ramesh Kumar, the seniors of IAP Malappuram, Joshi sir, Venugopal sir, Parameshwaran sir, our guest speakers today, Dr. Maya Bose and Dr. Susan, all my friends in Malappuram and across the state. First of all, let me congratulate Ramesh sir and Venugopal sir for their achievements this year. Now only 1 month left for Ramesh sir to take over as the National President-elect 2021. He's already busy with 2 talks in next 2 days in the Zoom platforms. As far as Ramesh sir's election is concerned, actually we were slightly tensed about the Malappuram votes in the beginning, but the seniors, Joshi sir and Parameshwaran sir, with the help of the state office bearers, district office bearers, Akbar and Duman, they made up the election within 100% of the expected votes. That was an extremely excellent performance by IIP Malappuram, and the IEP Kerala State thank all the members of IIP Malappuram for voting in such a large number. And as far as Venugopal sir is concerned, I met him first last year during the pet Criticon at Manjeri. At that time only I came to know about the 2 movies he made, the Stethoscope and the short film on immunization. So my request to the incoming state president is that we should take up that immunization short film during our next immunization week in April, with some more changes in the vaccine schedule. We should be able to release that immunization as far as only IMA can do something that can be released during the July 1st Doctor's Day. That is also a good movie. During the Doctor's Day, I had seen that movie, some clippings when I came there last year. So anyway, I congratulate Venugopal sir for his achievements, for getting the best family doctor award from IMA, and also beloved Ramesh sir for being elected as the national president.
Yeah.
Okay.
Yeah, over to Dr. Akbar.
Hello.
Sadiq, we will continue the felicitations.
Now I invite Dr. V. Parmeshwaran, past State's Vice President, to have some words. Permission, sir.
Hello, good evening. Can you hear me?
Yes, sir.
Yes.
Good evening, respected President Dr. Sadiq, State President Dr. Narayanan, our Chief Guest Dr. Ramesh Kumar and Venu sir, senior members of the profession and my dear friends. Dr. Ramesh Kumar is my younger brother and Dr. Venu is my elder brother. They are actually my brothers. We are deals in that way. We are lucky to have such a stars in our academy. You know, we all know Ramesh had done wonderful work as the Secretary General of IAP, and he is the first elected Secretary General of IAP. That too from Malappuram, sorry, Kerala. And the coming years, we can have more and more from him. I congratulate Dr. Ramesh Kumar and my best wishes to Dr. Ramesh Kumar. Venu sir is also simple, humble, sincere, approachable, just like Ramesh, in every aspect. One more aspect is he is an actor, not in our behavior. He is a good actor. He is acted in many movies, but he is social commitment. He made movies, spending money from his own pocket. One is Sadgamaya, that is on immunization, but nobody could understand the value of that. Later, he made another movie called Vivide Tupperide. That also was not seen more. Then one more movie on doctors, that is Stethoscope. We all could arrange some shows in some theaters. I think he has done one more movie because I was not aware, I was not in the social media since 4 days. Sir has made these movies from his own pocket for the social commitment, for the welfare of the society, for the welfare of children. I wish sir all the best and I congratulate you, sir. Thank you all. Thank you. Good day.
Now I invite Dr. Anand Keshwan, sir, our National Vice President, to say a few words. Please, sir. Hello? Can you hear me? Hello?
Okay. Very good evening. I'm driving. Respected President, State President Dr. Narayanan. Can you hear me?
Yes.
Yes.
Dr. Balendran and National President Dr. Ramesh Kumar, Dr. Venugopal, and other senior friends from Malappuram. It's very happy to see that IAP Malappuram is organizing a program CME in connection with the Disability Day, and also felicitating Dr. Venugopal. Venugopal, I think Venugopal I know very closely. His relation within we have a very long relation with the Dr. Venugopal, and disability. I think we already mentioned yesterday some points we have to address very seriously. I think whether I can tell here or not, I don't know. One or two things that to disability is it's not some problem here and there. We are seeing that because we are sitting in the disability clinic, we are getting a lot of problem. So we have to get a proper solution for the program. I think we can discuss the incoming president secretary about this, and Dr. Ramesh also will take some decision. And also, second thing is that whether our disabled children is getting proper care, attention in other area, means disability inclusion. I think that is the terminology they are using it, means considering equal status for the something like a child right, something like that. Okay, anyway, I wish the Venerable sir all the best, and also wish the
few words
all success.
chairman.
Thank you. Thank you very much.
Now I invite Pishardi sir, past president, to say a few words. Please, sir.
Can all of you hear me?
Yes, sir.
Yes,
sir.
yes. Yes.
I'm very happy to be with IAP Malappuram and other leaders of IAP, Dr. Dr. Ramesh Anandagasavan, Ramesh Balendra, Narayanan Balendran, and all my friends. Actually, the concept of the pandemic has helped us in many ways. That a lot of in the last 10 months or so, a lot of CMEs have been organized by IAP. It's significant. The last week we had the conference, Digi conference of child development and behavior pediatrics. In one of the sessions, some 5,500 people, probably not only pediatricians, but other parents and teachers. Such reach was unthinkable probably some months back. So in a way, COVID has helped us. Last year, we were planning to have a program for child development and disability issues. And last February, we had the meeting of neurodevelopmental chapter. But we have been expecting that the COVID situation will clear in some months' time. But now I think we will have to wait some more time. So we cannot wait till the end of the pandemic for child health and child development and disability activities. So this year we have, I think even by now, many branches have come forward to organize programs. This is one among them. And I congratulate the Malappuram team for this. And as Dr. Narayanan was pointing out, we should involve more deeply in child development and disability activities. And for that, we can make use of the services offered by the government sector through DAC and other health and social women and child welfare, as well as education departments. I wish all success to these conference and the Disability Week celebrations. Thank you.
Now I invite Dr. Jose Anthony, past president IAP Malappuram, to say a few words.
Good evening to all. Respected our President, Malappuram District Sadiq and Secretary Juman, and our State President Dr. Narayan and Secretary Balu, and the Chief Guest of the day, Dr. Ramesh Kumar and Dr. Venu Gopal. First of all, thanks for giving me opportunity to felicitation for the eminent personalities. Our National President-elect, Dr. Ramesh Kumar, is well known to me during the last 20 years. Since I know he's conducted a sessional conference at Pandalam. We all there, myself, Joshi, everywhere attended that conference. That in 2003, I think, prior to our state conference at Manjeri. We know how the way he conducted in a small place like this, well organized. Even the so many Bombay people also attended. He didn't share at that time. He conducted that meeting. He has also participated. We all know about Dr. Ramesh Kumar. Is a very good academician and also a very good administrator also. He's already proved his efficiency as a Secretary General of IAP 1819 and also very popular in all over the India. That's made it easy for us to canvass for his election, and he's well known for his honesty and also his transparency. Best wishes from our own from Malappuram team All the best for the Dr. Ramesh Kumar for his presidential year coming. And regarding our own friend, our senior colleague, Dr. Venugopal, all of the people this area knows who is Venugopal and what is his talent. He's a very talented person, both professionally and also in extracurricular activities also. He's a very good actor, already mentioned. And recently I got a clip from a film in epilepsy. That recent from YouTube only I got. So many YouTube films are coming. If you're interested, you can click and see. So many films are. It's all very good actor, It's in Malay, acted for so many Malayalam movies also. I used to follow him regularly. Anyway, our best wishes to the best doctor for IMA family doctor, to the really deserving person, Dr. Venugopal, and all the best wishes from all the members from the Malappuram branch. Thank you all.
Now I invite Dr. Faisal, past president IAP Malappuram, to say a few words.
Good evening, everyone. Respected national, state, and district leaders of IAP, senior colleagues, and my dear friends. I'm really happy to be here, speak about these two legends, and I am really honored to talk about them. First, Ramesh Kumar sir, Dr. Ramesh Kumar sir, my acquaintance with him started in 2006 when he organized a one-day CME that is about neonatal, about newborn in Pandalam or in Tiruvalla, I'm not sure, but that was a wonderful program. And after that, he has displayed his administrative and organization abilities in many events and programs. And I must tell you this, whenever we call him, there is a solution for any problem. So he won't say no. And I will call him as the S man of IAP, and keep above the Iron Man and Superman. So he's the S man of IAP, our organization. And also, there is a saying, with great power comes great responsibility. And he is the living example. He's one of the living examples for that. And he's a true inspirational leader, which we can follow. Youngsters can adore. And I'm sure he'll be doing justice to his next, the national president post also. All the best, sir. Talking about Venugopal sir, as already mentioned, he's a multi-talented person. He's a great doctor, an excellent actor, and above all, a wonderful humanitarian with a simple and humble character. He considered me, just like his son and cares like that. And we used to go to CMEs together. And I always fascinated by his quest for knowledge, which even the younger generation, they don't have. So he's also really a personality which we can follow. And I'm not talking about his acting skills, which everybody knows. And he's a fantastic actor. And his passion about film is so high that he took money from his pocket and made the film Stethoscope, which was well admired by all the doctor community and public alike. And so he is the real pride of Perindalvanna and our IAP. I wish him all the success, and I pray Almighty God for long health, for a long life and a good health. And once again, congratulate both these legends. Thank you.
Now I invite Dr. Ramesh Kumar sir for a reply speech. Please.
Respected President and Chairperson of the meeting, Dr. Akbar Sadiq, President of IAP Kerala, our great leader, Dr. Narayan, Vice President of Central IAP, and our great friend, Dr. Ananda Keshavan, Kerala IAP Secretary, Dr. Balachandran, Secretary Malappuram, Dr. Juman, past President of IAP Kerala and Chairperson of the Disability Chapter, and one person who was instrumental in making me what I am right now in IAP, Dr. Pisha Reddy. The doyens of pediatrics in Malappuram, I must say, Dr. Jyothi and Dr. Parameswaran, and the core team there, Dr. Jos Anthony, Dr. Jalil, Dr. Naushad, Dr. Nandakumar, and the youngsters out there, Dr. Akbar, Dr. Faisal, Dr. Shibu, Juman, and I have seen, and my friends, the faculty day for the day here, Dr. Maya as well as Dr. Susan, and a great person who is the legend who is being honored here today, Dr. Venugopal, and my great friends in IAP Malappuram, IAP Kerala, and those who are out in this platform today for the scientific and celebrations. Greetings, and I believe greetings of the Disability Week. I am really overwhelmed and humbled by the compliments as well as the remarks from my friends out here. First of all, my sincere gratitude to all my friends for you represent you in Central IAP as the national president. 2021. I'm proud to be here. I'm so excited to be here on two counts. One, for the Disability Week running in the day 2. This is a great moment because it was a great initiative from IAP Kerala Disability Week, and something which is the order which has to be the dictum or something which you have to be focused on in the coming down the line in the coming decade. So that's something we have just flagged off yesterday. And secondly, I've got a great humanitarian, as Dr. Faisal has put it, as my seniors others have put it, Dr. Venugopal with us today. And I must start off with Dr. Venugopal because I had got great respect, lot of adulation for this man. I met him earlier in Pantalam when we had a session, and later on last time in Kannur when we had the Pedicon, I had a long chat with him, and that time only I realized how such a man with great potential, how much effort he is putting into the social commitment to make our knowledge disseminate into the community in a better way. And he is working on his own without reaping any benefits, any fringe benefits or anything, but focusing on his own. So I feel he is rightly honored here by the IMA as the doctor, as Dr. Narayan has put it. I'm not sure, I have not had a lot of interactions with him in the past, earlier than that, but an astute clinician, somebody who has been out there for the families, so rightly honored as the best family physician by IMA. So my congratulations and for you, Venugopal sir, and may I wish you great good health, happy life ahead, and lot more to contribute to IMA, IAP, and the children for the country or also the community whom we take care of and who we are the stakeholders. Out there for Malappuram branch friends, I was so happy that you have really been a revelation all through. And you had the state conference in Manjeri. It was all great times for all of us and other conferences in Manjeri. Always remember that VP Convention Hall where we had so many meetings, and Joshi sir and Parameswaran sir with Jos Anthony. And even last time during the election campaign also I stayed with Jalil sir. All of you had so much of your team has dealt well, and so much of contributions coming from Malappuram branch to IAP Kerala. We have contributed president, we have got vice president, Dr. Parameswaran sir, President Joshi sir, so many seniors. So the branch has been contributing immensely to the activities of IAP Kerala at large, and during even more specifically during the run-up to the elections also the recently concluded elections. So my congratulations to our team who are making it big in all arenas, especially academics, organizational, and all spheres. And I'm so happy that the Disability Week is going into the second day here today. And special congratulations again and again to the visionary leader, Dr. Narayan, ably supported by Dr. Balachandran and the team from Dr. Pishagdi sir and Dr. Sushma ma'am, all in the district early investment. As Dr. Narayan has put it, the early DICs are to be more effective, and we need to coordinate better with them. We need to work out the logistics or how we can operationalize this in a better way, because we are having a lot of ideas, inputs are there, and we are working on our own in certain institutes, different places, but how to coordinate it and how to be taken it through the ASHA workers to benefit the community at large. That's what we need to put our heart and brains into it, and we can really work on it. And myself in the coming years can take it together with Anandagarshan and all of this contributing in a big way. And we have got two eminent faculty also here today, as now two dynamic youngsters are out there, Dr. Susan and Dr. Maya Vinod, who are the pillars of, I think, the developmental pediatrics in Central Travancore and contributing in a big way. So I'm sure with the IAP Kerala as well as IAP Malappuram is marching ahead in a big way. We as a family are growing big, our academics is growing big, our organizational activities are going big, and we need to take our efforts to be really to the community. And as Dr. Venugopal is putting it, wherever platform, as Balachandran has rightly pointed out, it can be taken up as a next year in the immunization, one maybe a little bit of editing. IMA can take it of the stethoscope. So from our side, these are all things the visual media has taken its impact everywhere. So we need to go through the digital media through more and more. If you put whatever better audience, better visibility we can gain through is always a bonus. So we not keep quiet because this is one area, and Dr. Venugopal's efforts should really pay off, I believe. So thank you so much, IAP Malappuram, especially Joshi sir and Parameshwaran sir, the seniors.
Thank you.
And for the opportunity for giving me the privilege to be there with you and sharing your love and affection as a younger brother, as a friend, all through. And I'm so overwhelmed by the way you have put compliments or whatever it is. I'm really happy about why I am there in IAP Kerala, and I as a good friend of IAP Malappuram all through. Thank you very so much, and wish you a great scientific meet here. What the faculty are eagerly waiting. Our members are out there. So wish Narayan and Bala and the team ahead a great disability week ahead. Thank you very much. Jai IAP, Jai Hind. Thank you.
Thank you, sir. Now I invite Venugopal sir to say a few words.
Am I audible? Kerkanda?
Yes.
Respected President Dr. Sadiq, state leaders, the President Dr. Narayan and Balachandran, and President-elect Dr. Ramesh Kumar, and my dear friends, I am extremely happy for the felicitations and the nice words. I don't know how I got it properly. Anyhow, I am very happy. I am extremely happy that I am felicitated along with the national president. We are going to the national president with Ramesh Kumar, and I'm very happy with that. And I see, regarding that immunization.
Sir, you are muted, sir. Sir, you are gone muted.
Yes. Can you hear me?
Now we can hear.
Amen. Actually, it was funded by NRHM, even though I made it, and when I approached Joshi, Parameshwaran, and all my friends in Malappuram, I got a lot of support, and they all participated. You all have acted in that. Actually, I tried to bring in all our friends into it. And when I made the stethoscope also, I think the IAP Malappuram stood with me, and they sponsored it for 3 days, and went on for a week in Malappuram and in Manjeri. I'm extremely happy and proud. I will say I'm very happy and proud to be a member of IAP Kerala, and especially Malappuram. Anyhow, thanks for the nice words and felicitations. Thank you, and expect all the leaders help in future also for my little contributions. Thank you. Thank you.
Thank you, sir. Now we will start our CME program. I invite Dr. K.K. Joshi to chair the session. Dr. K.K. Joshi retired as consultant pediatrician from General Hospital Manjeri and is at present working as senior consultant pediatrician at Prashanthi Hospital Manjeri. He was the president of IAP Kerala in 2004. He was awarded FAAP in 2016. He was EB member of CAAP in 2017 and organizing chairman of Pedicon Kerala 2018 at Manjeri. Over to you, sir, Joshi, sir.
Thank you, Dr. Akbar Sadiq, for the nice introduction. Dear Dr. M. Narayanan, President, IAP Kerala, Dr. Akbar Sadiq, President, IAP Malappuram, Dr. Ramesh Kumar, President-elect, National IAP 2021, Dr. Venugopal sir, Dr. Balachandar, today's speakers, Dr. Susan and Dr. Maya, Dr. Juban, senior pediatricians, and my dear friends. Before starting the CME program, let me speak a few words felicitating Dr. Ramesh Kumar and Dr. Venugopal. I make use of this opportunity to congratulate Dr. Ramesh Kumar for his great victory in the recent election to the post of National President-elect of IAP 2021. My best wishes to him and for all his future endeavors. I also congratulate Venugopal sir for the great achievement. Apart from being a good human being and pediatrician, he is a very good artist. IAP has to utilize his talents in filmmaking and acting for the benefit of our children. We have to utilize our connections to telecast his feature film Stethoscope in a TV channel during the next Doctor's Day. His short movie Sadgamaya on immunization also has to be fully utilized by IAP after making necessary alterations. I wish all the best to Dr. Venugopal sir also. Now, we are starting our CME program. Today's first talk in the CME program is helping differently abled children through adolescence. The speaker is Dr. Susan Mary Zakaria. Dr. Susan Mary Zakaria passed her MBBS, DCH, MD Pediatrics, and Fellowship of Indian Academy of Pediatrics in Developmental and Behavioral Pediatrics from CMC Vellore. He has worked in CMC Vellore and St. Mary's Hospital, Manarkad. At present, she is developmental pediatrician at Aster Medicity, Kochi. She has lot of skills and trainings in developmental pediatrics. Her main area of interest is autism spectrum disorder. She is also interested in behavioral disorders, CP, ADHD, specific learning disabilities, etc. She is passionate about advocating for child rights. She has also published articles in Indian Pediatrics. Moreover, my MBBS classmate, Dr. Daisy Cherian. I don't want to be an obstacle between the cup and the lip. Over to Dr. Susan Mary Zakaria for the talk on helping differently abled children through adolescence. Over to Dr. Susan Mary Zakaria.
Good evening. Am I audible?
Yes.
Thank you, sir, for that very kind introduction. I would also like to extend my congratulations to Dr. Ramesh Kumar and Dr. Venugopal for all their wonderful achievements. And I am thankful to IAP Malappuram for giving me this opportunity. Okay, I shall now share my screen. Please let me know if you can see it. Is it visible?
Yes.
Okay. So, the reason why I thought I would speak a little bit on helping differently able children through adolescence is because we have a lot of activities, a lot of things focused on early intervention, early detection. But as they become adolescents, they tend to get more neglected and pushed into the peripheries of society. So if we look at what adolescence is defined as by WHO, it's defined as from the years 10 to 19 years, though 18 years is the legal age for being an adult. And we all know that there are marked biological changes, cognitive adjustments, and social transitions that happen during this period. And young people with disabilities face much more challenges than their peers, also because they also have the same desire to have the developmental experiences and social opportunities as their peers. But unfortunately, their capabilities are not at par with what their hearts desire. If we look at the changes that happen in adolescence, I'm sure we as pediatricians are all very well aware of this, that there are lots of physical changes that occur, a lot of cognitive changes that occur. They start having abstract thinking, hypothetical thinking, metacognition. All these changes are also there in children who are developmentally challenged. There are changes in the social structure. They are more bound with rules. They have to meet expectations. They are also subject to peer pressure. They also long for relationships. And sexuality is a very much ignored aspect that is seen in adolescents who are developmentally challenged. Emotional changes such as increased self-awareness, wanting to be accepted by peers, needing to regulate themselves that they may not be well trained in. And behavioral changes are also very commonly seen in adolescents, not just because of the change in the hormones, but also because that they have this wide gap between what they desire to be and what they are able to be. There are issues with privacy, issues with safety also coming in. If we look at the International Classification of Function, Disability and Handicap, the child and youth version, we see that disability is defined by the effect of the environment on a person's limit, on how it limits a person's function, activity, and participation. So more than what challenge the person has, or the adolescent with developmental challenges have, it is the reaction of the environment that actually ends up making them disabled. So the assistive devices, the physical environment, and attitudes and stereotypes. Attitudes and stereotypes are the most difficult to change of all of these. And by changing the environment, we can actually make a big difference in the lives of these adolescents who are developmentally challenged. Now, what about literature? When we look at literature to help us understand more about what are the challenges that these adolescents face, we find that there is a severe lack of studies in this area, particularly from lower and middle income countries. And even studies from high income countries are few and poorly done. So this is like one aspect, one very important phase of a person's life that is really ignored and pushed to the peripheries. And when we look at the ground reality in India, may not be so much in Kerala, but in majority of India, there is definitely increased direct and indirect costs. And these costs always increase as the child ends up getting older, leading to much neglect and abuse. And in many parts of India, the children, especially who are like GMFCS 4 and 5 stage cerebral palsy, who have severe autism spectrum disorder, do not even survive till adolescence. So my outline of basically the things I want to cover very, very briefly, because this is like quite a vast topic. are the medical issues that emerge in adolescence, the various psychosocial and behavioral issues that are seen, how we should start discussing and addressing sexuality in differently able teenagers, what is the effect of on the parents as their child goes through adolescence, what is the role as a pediatrician, and what is the way forward. So coming to medical issues, we have to remember that children who are developmentally challenged end up having a poorer overall health and nutritional status when compared to their peers. This is again mostly because, like I said, the more severe their challenge, the more they end up being neglected, ignored. So they end up having various nutrient deficiencies like iron deficiency, vitamin D deficiency, worm infestation, severe dental caries that are not looked at. They end up being malnourished, or they can even go the other way where they end up being obese because they are given a lot of food and just made to sit at home. In addition to this, incomplete vaccinations is something that is very commonly seen, particularly because as a child becomes older and it is more difficult to get him or her to hospitals to vaccinate, the 10-year vaccines, the ones that have to be given at 15 years and all end up getting definitely end up getting missed. And if the ones before that, at the 5-year is completed itself, sometimes it is a big thing. We always tend to see the developmentally challenged adolescent as a developmentally challenged adolescent, not as an adolescent with developmental challenges. So the focus ends up being more on their challenge than on the fact that they are adolescents. But like any other typically developing child, they are prone for various diseases and disorders that emerge in adolescence that end up getting missed, like epilepsy. Epilepsy is something that is common that really gets missed. And other things are psychiatric disorders like depression, anxiety disorder, obsessive compulsive disorder. You can have schizophrenia that comes in that may have nothing to do with their underlying developmental challenge, whether it is cerebral palsy or autism or ADHD, but it is an added disorder that comes in because they are going through adolescence. The various autoimmune conditions like type 1 diabetes, inflammatory bowel disease, and also rheumatological conditions like JIA and connective tissue disorders are all. When we look at the number of children we see a higher percentage among children with autism who have these conditions when compared to the general population. And making a diagnosis of these conditions are quite challenging because particularly if the adolescent is non-verbal, it may just manifest as changes in behavior, which is attributed to them going through the pubertal changes, and instead of looking for a medical cause for them having behavioral issues. Now, what about the various psychosocial and behavioral issues that are part of adolescence, that is there as part of being an adolescent? I'm sure most of our seniors who have children who are adolescents and most of us juniors who have gone through adolescence can recently, or rather not too far off, can vouch for the fact that we ourselves go through a lot of emotional turmoil, emotional issues during that period. So you can just imagine the state of a child or young a teenager who is not able to verbalize it or is not able to communicate. So they do not actually perceive themselves much different from their typical peers. This is obviously because we have data lacking from India. These are studies from the West. But in the West, a teenager who has a developmental challenge that has been there since birth, they do not see themselves any different from those around. But it is not the other way, because people who do not have challenges are more easily able to identify those who have challenges. And that kind of is a big barrier in developing friendships. And like any child, they also value friendships. However, they have poor social skills and less opportunity to make friends. So what happens is that they have this desire for independence that is natural, that is part of the psychosocial stages of development, Erickson's psychosocial stages of development, the desire for independence, the desire to be able to do things by themselves. But this vies with parental concerns, because especially in India, parents tend to infantilize their children. Doesn't matter how old they are. I know my own friends and people I know who are like 25, 30 plus, who will not go out with their friends to a movie theater, will not go out for food with their friends because their parents don't like it. So parents continue to have, in our culture, parents continue to have a great influence on children, preventing them from being independent adults themselves when they are typically developing children. So you can imagine how much more it will be when the child has a developmental challenge, where parents tend to infantilize their child, and so the struggle for independence, the struggle to find out what they are worth is seen more as a rebellious behavior rather than part of being a normal development. Greater sense of loneliness comes in for these children because they realize that they are not able to attain what they want, or they feel very much left out. There's a higher chance of social conflict, again because what they want they are not able to get across to their parents, who have difficulty letting go of the reins. Their search for identity, and that is influenced a lot by how their family and friends sees them. So if the family and friends treat them as individuals, give importance to their desires, allows them to make choices in what they want, allows them a degree of freedom to explore their surroundings, to learn skills needed for independent living, they become more confident and they have an identity of their own. Otherwise, what happens is that they end up having something called learned helplessness, where they feel that they will not be able to do anything by themselves. They have difficulty forming attachments again because of poor social availability. And again, reiterating that the struggle for autonomy is always fighting with the feeling of helplessness that they have, and they end up to have low self-esteem, greater anxiety, and higher depression once they become adolescents. Now, sexuality. Sexuality in India is a much taboo subject still. I do not know whether parents even now speak to children about sexuality, about the experiences of puberty. I know for a fact that I was unaware of it although I did study in biology and all, I had absolutely no idea what the whole thing was. And I was kind of that way a late bloomer. Everyone else in my class knew. So that open discussion of sexuality doesn't really happen in our culture, but it is an important aspect to be discussed, particularly with children who are developmentally challenged, because they are more likely to get to be abused. So it is a normal part of development. There's nothing to be ashamed of. Parents should be able to have an open conversation with their child about this, with the support and guidance from their pediatrician. And there are enough resources that are available to parents. Actually, just I think 2 weeks back, I attended a webinar where they were discussing as to how do you teach children about sexuality, children with autism, children with developmental disorders, how do you teach them about sexuality? And there was another webinar on how to foster independence in them. So especially now with the COVID season, there are lots and lots of information that is available, especially to parents who know how to access YouTube and who know how to search for it. But again, the important things are that we do not wait till the onset of puberty to talk about this. It needs to start young. How young? By 4 to 5 years of age itself, you need to start teaching children, both typically developing and those with challenges, what is good touch and bad touch, particularly since the world we know is there are lots of cases of child abuse coming in. So they have to know about good touch and bad touch. You teach them to say no when he or she doesn't want to be hugged or kissed, even by a relative. And especially in our setup, when Amachi, when the grandmother comes to hug and they don't want to hug and they say no, grandparents end up feeling hurt. But that we should get out of that mentality, because that is a child expressing his or her right to his or her own body and feelings. We should learn to respect it, and that is something that I think all of us as adults, we need to understand, that just because a child doesn't want to be hugged, doesn't want to be kissed, doesn't mean that they don't love us. just means that they are uncomfortable with that touch. And if they say no and are not listened to by people that they trust, it is very unlikely that they're going to say no to a stranger. Teaching about privacy from early childhood itself is very, very important. We all know that children, especially boys at young age, they are allowed to go to walk around naked. They are allowed to go into the yard and pass urine there. And it is not considered, it is considered as part of our culture, part of bringing up a child. But what happens is that this very same boy, especially if the child has a developmental disorder, this child is not going to or will have difficulty understanding that when he grows up, he has to go into the bathroom and remove his underwear and pass urine there, not remove his underwear in the bedroom and walk naked all the way to the bathroom. It becomes an issue when the child for any reason has to share a room, be it if they go for a trip with their friends, or be it if they are going for something else where they have to be where they have to share a room with someone. It creates a lot of problems simply because importance of privacy is not taught from early childhood. So sexuality teaching should start from early childhood, not after the teenager attains puberty. Also,
please mute.
there is a problem with there being double standards. I know of a child with autism, a girl with autism, who was told strictly by the parents, who was taught by the parents that she should not come out in her undergarments. She should dress inside the bathroom and come out in her clothes. But what happens is that on TV, you see women in skimpy clothes. And so there is a confusion there, because on one side, parents are telling you that you shouldn't walk like this. She doesn't see her sisters or her mother walking like that. But on screen, women wear skimpy clothes. So these are all challenges that parents face as they try to teach children privacy. Allow them to explore their body. From around 3 to 5 years of age, all children, boys and girls, will explore their body. It is part of natural development. The moment they touch themselves, scolding them, taking their hand away is not the way to do it. Allow them to explore, start teaching them the correct terms also for it. That is very important. I had once attended a webinar where a woman was teaching, or what she was telling was as to how once happened that she taught, or someone that she heard taught, that the vagina for a girl was given the name flower. And then when someone abused her and she came and told her Amma that uncle touched my flower, mother did not understand that she meant that she was abused. So teach them the correct terms, particularly as they grow older. When they are young, you can maybe say susu place, potty place, use those words. But as they grow older, they need to know the correct terms. It is not wrong to call penis a penis and vagina a vagina. It is natural. It is our inhibition as parents, as what will other people say, what if he says it out of context. But teaching them the correct terms is very important for them to understand and learn about their own sexuality. Important things for boys that need to be concentrated on, particularly in adolescence, is that we need to teach about the changing body, changing hormones, moods, hygiene and privacy. Again, like I said, from childhood needs to start. You do not start teaching about sexuality once they turn 13 or 14 and they start masturbating in public. Reproductive process, sexual desire are all things that need to be openly discussed. Wet dreams, again, the reason why I bring this up is because children, once they wake up after a wet dream and they feel wetness, they assume that they have wet the bed, and that makes them feel low, because that is something that they should have had a control over. But realizing that it is a normal part of growing up makes things much easier for them. Reiterate again: good touch, bad touch, trusted adults, know, run, and tell. The three important things of preventing a sexual abuse. All these are things that need to be reiterated over and over again. acceptable public behavior, private behavior. These are two things that have to be again taught from childhood. What can you do in public? You do not touch your genitals in public. That is only in the privacy of the bathroom. So these kind of things, again, like I said earlier, are things that should be taught from the very beginning, from childhood itself. Boys, unlike boys, are more likely to get exposed to pornography because in the current era, I know normal, typical boys itself get exposed to pornography as early as between 9 and 10 years of age. So children who are developmentally delayed, if they are going to a normal school, it's much more likely that they are going to get exposed to pornography. If your child has to be confident enough to come and tell you about it, that level of open communication should be there, which again should start from childhood. For girls, again, introduce the topic of menstrual cycle by the onset of puberty itself, meaning the first time breasts develop, at least by then, start introducing the topic of menstrual cycle, acknowledge the changing body and emotions. Again, good touch, bad touch, trusted adults, discuss acceptable public behavior, private behavior, manage all menstrual issues like that for normal teenagers. If they have excessive bleeding, if they need to go to a gynecologist, take them to a gynecologist. If they have pains, manage it like how they should manage. Premenstrual dysphoria, premenstrual syndrome. These are all things that are normal for normal teenagers. Just because a child has a developmental challenge doesn't make it that they are not going to go through it. They will definitely go through it. Masturbation in females is something that is still a taboo in our society, but it needs to be discussed about. Pregnancy, how pregnancy happens, what can you do, protection, and all these are things that we have to start talking to our children. Now, how do we do all this, especially for a child who is nonverbal, or especially for a child with diminished intelligence? How do we do all this? There are a lot of resources. I want to introduce you, for those who don't know, there is a trust it is based in Karnataka called Enfold Trust, and they have good apps, child-friendly apps that are downloadable from Google Play, Apple Store and all, which actually have stories meant for from 6 years to 18 years as to how to take care of yourself, how do you, what is sexual abuse, what are the no touch zones in our body, or simple stories, and reiterating over and over again that because you get touched or because you get abused, it is not your fault. So all these are very easily accessible apps. This app is available in 10 languages in India, but unfortunately Malayalam is not one of them. There is Telugu, Tamil, Kannada, Punjabi, Gujarati, Marathi, Odia, Bengali, Hindi, and English. But it's not there in Malayalam. I wish we would maybe take it as a step to collaborate with them and bring forward a Malayalam option also, because this is a really, really good site. They also have this kit that is called Suvidha Kit. So this is actually how they teach children all about the sexuality. So they have pictures of people that need to be put in the order. What are the appropriate genitals? What are the no touch zones? What are the various rules that you need to follow? All using pictures. That is what children who are developmentally challenged understand better than words. And they have puzzles that they have to play with it. There are various flashcards saying when this happens, what to do, when this happens, what to do. So it's a very systematic teaching approach that is there. We have this resource. It is just that many people are not aware of it. There are so many books that are there. So this set of books, Ellie and Tom series, it is for children with autism spectrum disorder, both about puberty as well as about sexuality, masturbation, as to how to approach the opposite sex. And all this is, there are enough books. Again, all these are Western books. When I was looking for Indian books, there is something that is what's called Just for Girls, Just for Boys, again, to introduce the topic of puberty, which I think should actually be introduced to even our normal children, because it is part of normal physiology. There is nothing to actually be ashamed about it. So these are all good resources, good books. They use social stories. They make things simple for children to understand. And it is not something that has to be behind curtains or behind or something that should not be talked about in public. Now, stopping menstrual cycles. I remember when 3 to 4 years back, one parent had come, teenage child, I think 15 years old, with GMFCS5 cerebral palsy, completely bedbound from a very, very poor family. Mother has to leave this child alone at home and go for work. And she was living in not a very safe neighborhood. And so she wanted to stop the child's menstrual cycles so that she will not get abused or the chances of pregnancy is less. So this is a very, very difficult decision to make. It needs a lot of counseling, needs a lot of time. It's a big ethical decision to make about stopping menstrual cycles. And the process does have long-lasting consequences. It is not just a simple decision to give an OCP and stop it entirely. Always try and find out the specific reason why they want to stop menstrual cycles. If it is because difficulty in changing pads, ignorance, it is just caregivers are uncomfortable with it, those are all aspects that can be discussed and trained and taught, because complete amenorrhea is very difficult to obtain. There are methods that can be used, like combined oral contraceptive pills, but especially in children with limited mobility, like cerebral palsy and all, and if we have estrogen in them, they have higher risk for venous thromboembolism. Of the various methods, actually, levonorgestrel IUD seems to be the best, but acceptance in Indian culture, where the hymen is given so much of importance, is something that needs to be looked into. Then another thing that used to be very popular is DMPA, because you just take a 3-monthly injections. But again, amenorrhea is not complete. You do have spotting in between. Definitely affects bone density, particularly again in non-mobile children or in those with limited mobility. It causes obesity, which again further hampers their mobility and also their interaction with other children. And again, the problem with all of these hormones is that they all worsen behavior, because it causes a lot of mood swings. And that already in a child who is experiencing so much hormonal changes and so many other extraneous factors for the child to worsen behavior, this is like an adding fuel to the fire. Now, surgical menstrual management is something that is very rarely done. It is not really recommended, but there are two options that are there. There is an endometrial ablation, where you have amenorrhea in 25 to 40%. Will definitely need to be repeated if the person is less than 35 years. However, and it affects fertility, which is similar to sterilization, but it is not recommended by ACOG in teenagers for menstrual hygiene. The other one is hysterectomy. Hysterectomy is like a very major decision to be taken, and it does prevent pregnancy, but it doesn't prevent abuse or mood fluctuations. So that is something that parents need to understand. And obviously, it is a difficult surgery, or rather, it is a surgery. So you can have post-surgical complications, and there are a lot of ethical issues regarding the consent, because a child can't give consent. I'm just telling this for completion's sake, because we do face such children. Parents who are distraught, who don't know what to do, who are worried about their child's safety, who can't manage the teenage child's menstrual cycles and the difficulties associated with it. And until and unless we have an idea about what are the various options, we will not be able to have an open discussion with them. Okay, so what is the effect of adolescence in these children on parents? As you can imagine, it's a lot of stress. So a lot of issues come in. The behavioral changes of puberty is the societal perception, because a child has grown big, behaviors have worsened. Parents feel more shunned by society. They feel like a failure. They are not, even children who are relatively doing well may end up having behavioral issues because of added on anxiety disorder, added on depression. And so the poor parents and family ends up being more socially isolated. They are obviously worried about the future, because they are also becoming old. They are realizing that the child's difficulties are going to be lifelong. What is going to happen to them after they go away? personal health problems, mental state of other siblings. Will my other child end up getting married because this son or daughter has this developmental challenge? And also those children, are they able to form good friendships? Are they able to form good relationships? Struggles with spouse or partner are usually common once children end up entering adolescence. There's a reduced sense of competence because there is this fight for autonomy from the child's perspective, and this fight from the parents trying to keep the child a child for as long as possible. And they are confused. There is not much direction. There is hardly any support. There is no clear protocols on what needs to be done. All these are lacunae that we have. There is limited help from government and non-government sources, and a lot of financial and medical needs coming in as the child grows older. Because as the child grows older, you realize that the child may need to be on medications to help control the behavior. So the medication expense will come in. And then again, some people even lock up their children at home and because they have to go for work, because the behavior is so unpredictable. So lots and lots of issues that parents have. So as a pediatrician, especially as a family pediatrician who has seen the child from a young age, what is your role? You need to be aware of common medical disorders that may alter behavior of the teen before labeling it as due to puberty. Be on the watch out for emergence of psychiatric disorders like depression, anxiety disorder. Be open and discuss about body changes. Invite questions from the teens, particularly those who are verbal, even those who are non-verbal but who are using communicative devices. Ask them to form, or especially if you are a pediatrician who's been seeing the child from the time that they have been young, they are close to you. They may end up confiding more things to you than they do to their own parents. Prepare the family from the beginning. This is very, very, very important. The more we talk about early intervention is not just academics. That is what many people unfortunately think. So it is about promoting independence and self-care, focusing on communication. Two main things that need to be done. Teach the parents how to manage stress, about giving their children, even as they are children, choices in what they need to do. Role of siblings is very important. Siblings are a great wealth for children with developmental challenges, because they are like the second mother, and more than a second mother, the children with developmental challenges are able to learn and imitate from what the sibling does. So they are very important in promoting independence and integration, because if the sibling takes the child wherever they go, the child learns how to do things by themselves. And there are lots of positive benefits, but also there is a problem with psychological burden on the sibling, because they end up feeling guilty if they have to leave their family for higher studies. They end up sometimes they end up going into depression because they feel that they are getting joy that their sibling doesn't do. So there is a lot of psychological burden on the siblings that pediatricians need to be aware of. So if you see a child who has an issue and that child has siblings, spend 2 or 3 minutes with the sibling. Fine, let them know that you are there with them. Ask them how they are doing, because they will not be sharing any of their issues that they have with their parents, because the parents already have too much to bear. Promote use of technology. Technology is a wonderful thing. Unfortunately, for most people, it is used only for watching movies and playing games. But especially for children who lack the ability to make friends offline, they can make friends online with known people. So there are various disability groups that are there that these children can join in and find common ground and start chatting with other people, so that they have a sense of inclusion and a sense of belonging. Extracurricular activities is very important. And again, empower teachers in school for adaptation of educational materials. So I know of a child who would feel very bad that the child was not writing any exam. So she studied up to 9th standard in a normal school. So what the mother would do is that the mother would study few portions, would prepare her own question paper and give it to the teacher, to give it to this child while during the exam. The school didn't mind, because anyway they knew that this child is not going to write 10th standard. But that feeling of achievement, the feeling that I wrote the exam with my classmates, that I got an answer paper back, I got marks. that is a great source of joy for that child, makes her feel more at one with her class rather than being excluded. So there are methods that can be done to help this child again be included in the mainstream school, so that other skills are learned. Promote participation in sports, very important, because it again helps build team spirit and helps them, gives them an opportunity to develop friendships. Be aware, look out for signs of bullying and abuse, and help the family recognize skills for future. Vocational training opportunities is something that needs to develop and needs to be looked into for them, so that they can lead as independent life as possible. So things that we need to do is that there definitely needs to be more research on issues that adolescents with special needs face, and from childhood. The problem with it's not the problem, the difficulty that parents face is that they are trying to survive one day at a time. They are not, at times they see the distant future and they get worried, but what needs to be done now to help in that distant future, they are not able to see. That is something that sometimes even the therapists are not able to do. Like we see children with GMFCS 4 who have not even started sitting when they are 4 or 5 years old. And we know very well from studies that if they haven't sat by then, they are not going to become independently mobile. So rather than working more and more and exclusively on teaching the child to walk, teaching the child academics or looking for other skills is something that is going to help this child in the future. Getting them to a wheelchair, to a motorized wheelchair, and giving them independence, that is something that is going to help them in the future, rather than going for physiotherapy continually. So that kind of a long distance view, only a pediatrician, only people who are not really closely working with the child will be able to see that and to give that option, or to open the parents' eyes to that. So that is something that as pediatricians we need to do. Importance for life skills over academics, always. We see 3-4-year-old children who know A to Z, who are parents are very happy, children know A to Z, can count, can match shapes, name colors, but do not eat by themselves, are not toilet trained. That is not the focus. The focus is independence and life skills, because that is what determines how independent and how well they're going to transition through adolescence. Again, focus on communication, not speech, communication, be it through an AAC or through sign language, something. There should be a focus on communication. Behavior decreases, challenging behavior decreases a lot when there is focus on communication. Inclusion and social participation in as many settings as possible. Give them opportunities to. Again, professional parental collaboration and participation is must. Importance to sexuality and self-awareness, exposure to different environments, situations, and people. Life skill training, vocational training, assisted living facilities are all things, skills, and things that we need to develop. Government policies for inclusion in schools, workplaces, places of entertainment, financial assistance, etc. Actually, our government of Kerala has beautiful things in place. It's just that we have to be aware of it. We have to push it, integrate it, so that these children can become functional, productive members of society and lead a good life. And also self-advocacy. We have a lot of children with autism who are verbal, who can advocate for themselves. We need to include them when we decide about what are the various provisions that we are going to give. Include the parents, include them to be able to advocate for themselves, for people who are going through similar struggles as them, so that they get they are treated well. And always remember, it is always a multidisciplinary team approach, and we should always presume competence. Doesn't matter how severely you think a child is affected, always presume that they can do it. And just because we think the child cannot do it, that should not be a source of hindrance from us approaching the child, trying to teach them and trying to help them through adolescence. So again, always remember that there is something beyond the disability that the child has. There is a child. There is a growing future adult, a future citizen of India who is there. And we should start seeing children or adolescents not just as developmentally challenged adolescents, but as adolescents who also have some challenge. Thank you.
Thank you, Dr. Susan Mary Zakaria, for the elaborate, nice, and excellent talk on helping differently abled children through adolescence. We will have the discussion in the end. Those who want to ask questions, please type in the chat box. After the second talk, we will discuss. Now we'll go on to the next topic. Wait and see, should you or should you not? Harnessing neuroplasticity in growing children. This is the next talk by Dr. Maya Bose Vinod. Dr. Maya Bose Vinod is MD Pediatrics, FIAP, and board certified in general pediatrics in USA. She is at present working as developmental and behavioral pediatrician at National Institute of Physical Medicine and Rehabilitation, NIPMER, Irinjalakuda, in Trichy district. She had been working as general pediatrician in USA before she came back to India 6 years back. She has special interest in autism spectrum disorders and has been instrumental in starting intervention programs for children in autism spectrum at NIPMER. She has published many articles in international journals. She lives in Ernakulam with her husband and 2 teenage children and a dog. She loves to paint, practices yoga and meditation, and loves dogs. Neuroplasticity is the ability of the brain to form and recognize synaptic connections, especially in response to learning or experience or following injury. Today's topic is wait and see, should you or should you not, harnessing neuroplasticity in growing children. Over to Dr. Maya Bose Vinod for the talk.
Okay, I hope I'm audible and my screen is being shared.
Yes.
Thank you, Dr. Joshi, for that introduction. And thank you, IAP Malappuram, for giving me this opportunity. I would like to also congratulate Dr. Ramesh. I have been sharing his success from the beginning, for the elections and when we celebrated virtually. So congratulations to you, Dr. Ramesh, and Dr. Venugopal also. I have seen your movie Stethoscope and it is wonderful. So good to see that you have this new feather on your cap. So I'm going to start with my talk. As you can see, my topic is wait and see, should you or should you not? And this is regarding child developmental disorders. My main intention with today's talk is to drive in this one idea. So the topic is going to be very light on your neurons, but I'm hoping to get through to your heart. And I hope you all still have enough attention span. It is late. We just heard an excellent review by Dr. Susan Zakaria about an very important topic, actually. And I am going to actually go back a lot backwards in child's developmental age and talk about at the stage where they come in with symptoms and signs and symptoms and to you, and you are to make a decision whether to do something now or to wait and see. So should you wait and see or should we not? So there are many conditions that we see as pediatricians and we decide this does not need any intervention. This child needs to be dealt with urgently. We can wait and see. In fact, I think 2/3 of general pediatric presentations, we have to just see the child, reassure the parent, and counsel them. So it may be just a viral exanthem we don't need to do anything about, or a hemangioma or a umbilical hernia that we usually wait and see and say, let's wait till a year old and it might just go away. Or some fevers, we say we wait for 2 or 3 days and see if it goes away. So the question is whether when you see a child with developmental or behavioral disorder, should you wait or no? One of the most rewarding experience as a pediatrician is to watch children grow up as a neonate to cute toddler to sometimes raging and rebellious teens, and then they often become mature, healthy adults. To ensure that these children grow healthy, the core requirement is that the child is mentally and emotionally healthy and stable. And the same goes with the parents also. So imagine that you are seeing this child in a busy OPD with a multitude of different issues, sometimes life-threatening, some needing urgent attention. Children with developmental delays, especially mild, subtle ones, can be easily missed. So imagine that this mother comes to you with a child who's 16 months old. You look at the child, and this mother says that the child has a speech problem. She has not even said one word, and she's 16 months old. And you look at the child; she looks normal, healthy, nourished, playing quietly with the wheels on the toy bus she has in her hand. Or another child of same age who is speaking only about 3 to 4 words, but showing gestures and smiling at you, and even startled at the bell that you rang behind her ears. You was checking her hearing, right? So you would say, let's wait and see. That would be what most of us would say, right? So what about other issues like subtle problems? The child has normal language for age. This is a 3-year-old. Let's imagine another child in the picture. It's a 3-year-old. He or she is speaking in sentences. He sounds a bit monotonous, nevertheless speaking and responding, but he has kind of fleeting eye contact. He seems to be intelligent. He can draw a circle. He's 3 years old, so that's very appropriate. Knows his colors, shapes, and even started to recognize alphabets. So he would, look at the alphabets if you ask them. So, however, parents say that he prefers to play by himself and does not know how to play by rules with other children. So, I hope you know that the social communication disorder is a new addition to DSM-5. It used to be called social pragmatic disorder. The child has poor or awkward social interaction, poor use of language for social communication. However, no other features like repetitive behaviors or restricted interests or sensory issues like we usually see in children with autism. And then there is this 4-year-old with normal language, long language development and normal use of language, but only for his own needs. He interacts with his siblings and parents, but nobody else much except the neighboring child. And these are all real stories, by the way. And he's obsessed with alphabets and books. He only wants to look at these books and alphabets all day. So now, does this child fall under high functioning autism? It used to be called Asperger's in the past, or is it selective mutism that he's not speaking with anybody else but only people in the family and neighborhood? Or is it social anxiety disorder? Or is this just a shy temperament? How do you navigate these diagnoses and help these children, thrive in the society? So I have worked as a general pediatrician most of my life, and I'm sure you can relate to this story. So imagine that you are seeing your 25th patient of the day, and you're wrapping up, and your last patient tells you one more thing, doctor. And she goes on to describe a behavior problem or a developmental issue. For one thing, it requires a whole new consultation on another day to really understand what this child has, right? You cannot just tell a one-liner, it's okay, it's normal, without getting a whole history. but you have to go, there is a webinar to chair or to attend. Besides, this child, you've seen this child for for wheezing episodes or for some fever. You have seen this child before, and that parent is kind of anxious, so you say it's okay, we'll wait and see. The truth is, not even a village is enough to raise our present generation. We need professional help. We need, in fact, multidisciplinary intervention to deal with a child with behavioral or developmental problem. We need parenting classes, child counselors, psychologists, occupational therapists, speech therapists, pediatricians, pediatric neurologists, teachers, special education, the whole multidisciplinary team. All of this plus a dedicated, involved parent or a family member. So now, as I mentioned earlier, development is a continuous process with wide range of acquisition of milestones. And sometimes a delay in milestone, they do catch up, right? And they're okay. The child is okay. But often this is not the case. We as a community have changed the way we live. There is no more a village to take care of our children. Even if there are grandparents and aunts and uncles in those rare joint families, they are often busy in their own lives. There may be parents who play, talk, and spend time with their children. This can impact the child's development in a positive way. One thing what we need to realize is that often this is not really happening, especially when there is a real problem with the child, developmental or neurobehavioral problem. This interaction is not going to be enough. The parents need to be aware, the pediatricians need to counsel, and we need to spot the red flag, and always, if the parent do come with a concern, believe the parent. So I'm going to step into our topic, actually, neuroplasticity. What is neuroplasticity? It's the brain's ability to reorganize itself by forming new connections. And this happens throughout the life as opposed to what we believed before. And it happens in response to stimulation, to new situations, changes in the environment. And what we need to realize is that some areas in the brain, especially the amygdala and the, I believe it is the hippocampus that's involved in learning, the neurogenesis happens even after birth and in much later also. So this slide explains to you the amount of synapse. As you know that when the neurogenesis happens, there's a lot of these stages happens. Proliferation, then there is synapses, there is myelination, cortical maturation, all of these happens. And there is a lot of interest in synaptogenesis recently. In fact, autism spectrum disorder is being called synaptopathy by some experts. So what we really need to increase the synapses or these neural connections to form is an enriching environment that will help with these synapses. So what happens in the brain is it overproduces. It overproduces a lot of these neurons. And as you use it, more of those areas are proliferated. And if the child or we don't use those areas, the areas that you don't use, they're pruned. So it's use it or lose it situation. And the enriching environment, the environment has to be enriching. There is an interesting study that, in fact, Dr. Susan shared with me some time back, that what they did was they did an experiment with mouse. They compared with enriching environment versus non-normative environment. What is non-normative environment? What are our babies and children doing these days in lockdown? They are often glued to some kind of audio-visual material. So that is when, especially when the brain is forming in earlier years, that is not quite an enriching environment. Too much noise, too much light, these kind of non-normative environment what it did to these mouse, and also there has been studies in children, what they did was that they resulted in alterations in the brain, and it caused cognitive deficits, hyperactivity, and real detectable structural and functional problems in the brain. So the whole lot of so what we need to remember is enriching environment, and often under 18 months, under 2 years, enriching environment does not mean media. As you know, the screen use guidelines by American Academy of Pediatrics say under 18 months, 0 screen. Above 18 months, they do now allow educational content along with parents with interaction. And about 2 years and above, they recommend 1 hour or less. And I do understand with lockdown, it has been difficult for parents, but it's important to make these parents aware, especially young parents, how important it is that they spend time with the child, with quality time. In fact, there is a study. Well, let me go through this one. So this chart explains which area the synapses happens earlier on. So you can see in this chart, let me see if I can get the cursor on here. So the receptive language, the language and the speech production happens in the first 2 years. That's a thick line here. And the earlier synapses is happening in the occipital cortex and parietal and temporal cortex. So it really happens, the synaptogenesis happens from your back to front, occipital to frontal area. And higher cognitive functions continues the synapses happen in these areas until adulthood. So it's not that the neuroplasticity does not happen later on, but it is difficult. It is lot more effort is required from our side to cause some change in the brain. So this is what this graph shows, that the neuroplasticity happens, but it decreases over time. But the amount of effort required is more as the time goes. So how well are we doing? So this is from US studies, but I'm sure we can extrapolate it to here. I don't think we have equivalent studies done here. So only about 1/3 of children with development delay are identified by healthcare professionals. And that's why they recommend screening tools, standardized screening tools at certain ages that I will go through later on. And apparently the first concern by parents is usually by 2 years or just before that. And that's what we also see here. They come around 2 years, sometimes 3 years. And there are some patients who present much later. And the mean age of diagnosis of any development disorders is about 4 to 5 years, sometimes 6 years. The mean age at which early intervention is started is at 4 years. And that is not good enough. As you know, the prevalence of developmental disability in Kerala, this is the bottom line shows the studies done in Kerala by Dr. M.K.C. Nair and CDC, that the prevalence is 1% to 2.5%. And the autism spectrum disorder incidence is going up by every year. Our prevalence in India is 1 in 100. In US, the CDC reports 1 in 54. And these developmental disorders impact not only the child, not just the family, but also the society in terms of the cost and providing healthcare and educational support and schooling and etc. There is strong evidence to support that early treatment of developmental disorders leads to improved outcomes. It reduces secondary behavior problems. Later you diagnose these children, they end up with more behavioral problems. Added to it, the family's stress, and also the amount of effort required to bring back these children to some kind of normalcy. So this is a study that I put in here to emphasize the fact that this is a very interesting study where they compared children in institution. So this is the famous Romanian orphan study where they studied these children who are institutionalized without any social interaction. They were given food and everything else, but no, not any social interaction. And they compared it with normal children and children who were diagnosed with autism. And they found that a lot of these children who were socially deprived in early years had similar pattern of presentation as in children with the true diagnosis of autism. And this is what I'm seeing. This is what many developmental pediatricians are seeing. So these children who come early on, 2 years, maybe even before that, they come in with autism spectrum symptoms, and they have a strong history of excessive screen use, not 1-2 hours, but hours together. Parents think it's educational, or their hands are tied because they're busy, or they use it as a babysitter. Many reasons because of our lifestyle. So these are the symptoms that they come up with, and these are typical symptoms that we see in autism spectrum. So this is another study where they showed that the early screen exposure and autistic-like symptoms. This study showed that compared to less than 3 hours versus more than 3 hours, even less than 3 hours per day, children had significant language delay and short attention span and hyperactivity. And most of these children had very poor parent-child interaction, as you would expect. So I'm going to go through, I'm just going to give you a glimpse into a developmental pediatric OPD. And these are the patients that we see in real time. And I just want you to think what you would do next. And it's not going to be interactive, it's getting late, so I'm going to just go through it. But when I present, I just want you all to think what would you do next at that point. So this is Kunyutan. I chose Kunyutan because everybody calls their children Kunyutan apparently. And this is a 2.5-year-old child. And the first time I saw this child was when he was 1 year and 10 months. He said 2 words, but he called Amma to everyone and said a couple of other words. He had very poor eye contact. He communicated, but he communicated by leading the mother to the object that he wanted and going there and crying. He did have excessive screen use. Mother was not at all, not much concerned about his speech, but she was more concerned that he was toe walking now and then. And this is often the case. Many parents are, and sometimes many professionals are more concerned about the child is not walking, not that the child is not talking or showing any gestures. And he also played with cars. He loved cars. He loved to watch the wheels rotating. And he really did not follow your commands. And you checked for spasticity to see why he has a toe gait, but there was none. So what would you do next? Would you say it's okay, we will wait, which is the wrong answer now, already, or you would do something? So when I saw this child at 1 year and 10 months, we put him in an intensive training program, which was also for the parent training program, speech therapy, OT, development therapist, BT. And later it was locked down, so we all continued to support him and his parents through online. And the last visit, I just saw him a few months ago. He says more than 100 words. It's like he just bloomed. He has meaningful phrases. He asks for needs. And he actually told me, Ammim Nanum Kunyutanam Karl Tata Pogunu. That is like beyond what we expect for a 2.5 years old. And he has pretend play. So when the mother asked me, does he need intensive training? I told him, no. He's going to take PhD if we continue this intensive training. I was just joking, by the way. But of course, he needs continued monitoring and support. So that's one case. There's another child. Remember this child that I showed before, Kunyimol. She's almost 3.5 years old. I saw her when she was 2 years, 8 months. She had very poor language, poor social interaction, poor name call response, no eye contact. She loved to play with the wheels on her cycle. She also had excessive screen time. And on further questioning, the parents were extremely busy. They really had no social support or family support. So her 8-year-old sibling was placed under her care. And of course, the 8-year-old sibling did not play with this child because she was not very socially interactive. And her expressive language, ELA, is a standardized test that we do for language. It was about 12 to 15 months. Remember, she's 3.5 years old. Her expressive language was about 1 year to 1.5 years old. And receptive, what she understood was about 15 months of age. She was diagnosed with moderate ASD level 2 on our standardized tools and DSM criteria. We started her on an intensive training program with regular follow-up. She too came in during, the lockdown happened afterwards, and we continued to support her. 9 months later, her vocabulary expanded, better eye contact, more attention, more use of gestures, and her language age increased to 2.5 years. Even the severity of autism score came down significantly to mild level, according to the standardized tool we used. Of course, she remained with ASD features. Most often, if autism spectrum disorder is not cured, autism spectrum disorder is not curable. But I am confident that this child, Kunjimol, will continue to improve, and we can possibly integrate into a normal school. Before I go into this case, I just want to emphasize that these are success stories, but there are many other, or a few other stories that are not that successful. For instance, sometimes we have children presenting at 2.5, 3 years old. They just do not improve, no matter what we do. And there are two reasons. This is my inference, not from a study. One is severe autism with comorbid conditions that are not well controlled. Like Dr. Susan mentioned, if they have other physical issues like esophageal reflux, or constipation, or some kind of anxiety or seizures that are not controlled, it is extremely difficult to do therapy and improve unless you take care of the physical problems first. And also the second reason is not enough parental support. We have children who are high functioning autism or some other disorder, but parents have lost hope, or they don't have enough support, or they just are in search for some kind of cure for this child. So those children are not brought regularly for therapies, and it is very sad, but they don't improve. So these are the two reasons, and it's very important that we get counseling down for these parents initially, and ongoing counseling. So coming to the next, my presentation is Amar Akbar Anthony. I'm just musing with the words, the names, but it is not a very pleasant story. These children, let me go into the story. And this is the third child, Anthony. And I happened to see all these three children in a span of 1 or 2 weeks, and that's why I put them together. And this happened recently. So Amar is now 3 years old, 3 years and 2 months, absolutely no speech, no babbling, but he uses good gestures, good use of gestures. He looks at you, he smiles, and he's just so wonderfully communicating non-verbally. He does have a very significant history of being preterm, low birth weight. He had a significant postnatal history also. He did have a OAE done after birth, which he failed. He was asked to repeat it. It was failed. And there was a long gap. And this must have happened at birth, right? And then he was diagnosed with hearing impairment at 2 years. Hearing aid was prescribed, and he started to use the hearing aid at around 2 years, 6 months. His vaccinations were all up to date. And then the lockdown happened, and the parents could not take him for a reprogramming of the hearing aid. It wasn't working. This child has profound hearing impairment in the left side and moderate hearing impairment in the right. So now here's a preterm baby who graduated with honors, I would say, because he was completely normal in all other domains. He did have delay, but I didn't really go into detailed history, but he had delays, but he is completely fine in all other domains. And so he went through a perfectly planned system, hearing screen that Dr. Abraham Paul has started in first time in India, in Kerala, OEE for all children at birth, but somehow he fell through the cracks. Now the next child, Akbar, is now 2 years old, absolutely no words at all, again uses gestures, and parents really, this child also has moderate to severe hearing impairment. Parents really did not suspect because he startled at loud noises. So, you wouldn't think much. And again, these parents were only worried about the child walked or not. The child did not speak, but he did have very good non-verbal communication. Again, his vaccinations were up to date. So what is happening here? Are we failing these children, or is the system failing us? It is just something we have to think about. I didn't really talk about the other third child, Anthony. In fact, has a very interesting story. He also has a unilateral sensory neural hearing impairment, and that is this child. I mean, this is just a picture from the Google, but just to put a face to the story. This child has a story that has psychosocial significance. He has unilateral sensory neural hearing impairment. The other side of the other ear was completely normal. The family hesitated to use a hearing aid. One, because the child was not cooperative. Second, because they were worried about what the society, what the family would say, and what they have to explain to other people around them if the child used hearing aids. So it took a lot of counseling and a lot of psychotherapy, psychological intervention to the parents before this child was started on proper hearing aid use. So Kunju is my next case, and I'm going to wrap up soon. This is and I'm going to just briefly tell you, this is a 5-year-old. These are all real cases that I've seen. This is a 5-year-old who called me just late with typical autistic symptoms, all severe autistic features with the behavior issues and the sensory problems. But the only thing only thing positive about his history was that he was very good in academics. I saw him, he was extremely hyperactive, no attention whatsoever, fleeting eye contact. He had these continuous vocalizations, no real interaction or communication, no response to his name. His physical exam was completely normal. The history was that he had some interaction in infancy, but then he regressed. And now he uses words sometimes, but not always meaningful. He has a lot of jargons. Sometimes he'll say a word and he'll never repeat it again at all. Sometimes he sings rhymes, but he won't use words for communication. And this is the common history you get for children with autism. He has no eye contact, and I said all this again. So the child was seen by a healthcare professional at 2 years of age. Both parents are well educated. Apparently, the mother was advised to quit job and spend a lot of time at home and do a lot of these activities that the healthcare professional prescribed. The person even advised against taking child to public functions, so they did not. And anyway, it was very hard to take the child to a wedding or some kind of event because he would not behave. And there was no formal therapies recommended. So when we saw him here, it was again lockdown period. We assessed him in person, but then all the therapies were given online. Mother was very cooperative and totally involved. She was given online instructions. The whole multidisciplinary team was involved. And currently his vocabulary exploded. I mean, we really didn't have much hope in this child because he was so severely autistic. But he has more attention now. He's still kind of hyper, but he does have some more attention. He does his activities. He started to gesture and has more eye contact. And more importantly, the parents are more confident and more hopeful. And this is what neuroplasticity in action. And it is real. And if we started it early, we can impact a lot more in children's lives. I think I will just skip all these stories. And what can you do? I'm going to skip to what can you do in your OPD practice? What can we all do? When we see all of these, your general pediatricians are in the front line. So think of it as, You are seeing all of these children and you have an opportunity to make a difference. So this is a chart IAP has brought out recently with the vaccination chart along with the milestones at each age. And it's very easy. As you see the child for vaccination, just look at this chart. I mean, of course, you know these milestones, but it's easier to do this when you're in a busy OPD. Just ask. Development surveillance means you're just asking the parent, does your child do this? That's all. And you make a record of if the child does this or not. And there are screening tools available. I'm sure because all of these explosion of webinars, you've already heard of Trivandrum Development Screening Chart. And this is an excellent, easy to use. I'm going to just tell you very quickly. So you're seeing a 2-year-old. So you draw a line across the 2-year mark. And what you expect is this child to do everything that is in this left side of this line, except the one that the line has crossed. So it's okay, they still have time to walk upstairs with help, but he should have done all of these. And if he's not doing even one, he has a delay and he needs what? He needs further assessment by, where is that slide? So what I meant to say is if this child fails a screening tool, what that child needs to have is a detailed developmental assessment by someone who's trained in detailed developmental assessment, development pediatricians, child psychiatrists, psychologists, etc. So as you monitor growth and development in your pediatric children, please remember to do surveillance. A developmental screening is recommended by both AAP and IAP at 9 months, 18 months, and 24 months using these tools. If you don't have the time to, you can always train the nurse or your assistant to do it. It's very simple. And also formal autism screening at 18 months and 24 months. TABC is similar to like TDSC. You just have to put a line and see if the child does everything on the left or no. And MCHAT is also easy. It's very easily done in an OPD by your assistant or your nurse. Also, no early signs and red flags for these common disorders, autism spectrum, ADHD, learning disability, school readiness. If any learning difficulty, always screen early for these learning disabilities before these children comes back with behavior problems, conduct disorder, antisocial, just because the child was not given early intervention or we did not recognize a red flag early on, these children end up with more severe problems in the society, more stress on the families, not to speak of the society. So always remember to check for vision, hearing, IQ, and get a holistic understanding of the environment, etc. So this is the slide that is missing before. I'll just skip that. So I've already gone through this. So this is development surveillance tool, and you could always pull up this chart is available on cdc.gov website. You can print it out and put it in your OPD so the parents know that what to expect. And and then there are always apps available, milestone tracker. You can always recommend parents to download this app. This one, or there's an Indian version, what's that called, Track and Act by Dr. Nandini Munkur in Bangalore. That's also, I believe it's free. Yes, it is free. And parents can download it and track their child's development. It's very easy. And this one, I think what I'm trying to open it. Anyway, this is just a poster that you could have put it up in your OPD. This is again a chart that shows a child's height and is available on cdc.gov, I think, yes. And you can put it up on your OPD. It's not moving, hold on for a second. Oops. Sorry about that. I'm just going to take a few more seconds, actually. Sorry about this.
Okay.
Oh my God. Okay. Can you see my screen?
Yes.
Okay. This is just actually I'm actually done. So options are many. All you need to be is willing to make a difference. This is just okay. So we make a difference. So should you wait and see? Never. Never wait and see. It's never the right answer. Act now. Thank you.
Thank you, Dr. Maya Bose, Vinod, for the excellent, informative, and extremely useful talk on harnessing neuroplasticity in growing children. Now we will have a discussion. I don't think that there are many questions, but there are some suggestions and opinions. I shall go through the chat. From Dr. Surendran from Manandawadi. Hi, Dr. Joshi. My greetings to Venu, the multifaceted personality, and my hostel mate and senior. That is from Dr. Surendran. Another suggestion, kindly put a word on Well Baby Checkup. Celebrate Well Baby Day also. We can pick up kids with delays early itself in Well Baby visits. That
Can I
is from
respond
Dr.
to that, Doctor?
Yes, yes.
Yeah, well, baby checkups are very popular outside India. We don't have that as a routine here, health maintenance checkups. So where normal children will come at certain time, and I mean, we do see children for vaccinations, but I believe most of us just focus on the vaccination and not a complete physical, emotional, it's a complete checkup with anticipatory guidance and developmental assessment and everything. So I think it's a great idea to start doing that and to pick up these children early. Like some of you private clinics or even the government can do something like that.
Okay. Dr. NS continues, these parents never come to a doctor until child is sick. That also, they first go to homeo and then to government hospital where developmental history and all not given much importance. We get parents with these developmental delay, disability children very late. Must give much importance to well baby checkups as advised by WHO in every 2 to 3 months. That is the suggestion. Government centers tend to miss out developmental delays due to high patient load. Must inform parents on this while leaving hospital after delivery. Also mentioning it in baby card and also well baby clinics in our hospitals. These are all suggestions. Good talk, Dr. Susan from Dr. Anas. Every pediatrician must think from the angle of a developmental pediatrician, take development history. Another suggestion, good presentation, Dr. Maya. Excellent presentation, Dr. Susan and Dr. Maya. From Balachandar, Dr. Balachandar. From Anas, a patient from Dr. Maya's neighborhood spent 1 year at Ayurveda. At 3 years only, she visited Dr. Maya and now doing therapy. That is from Dr. Anas. To IAP Malappuram, thank you, IAP Malappuram, and to both the speakers, both presentations were excellent. There are no questions. So I think we will conclude the session. Thank you, both speakers, once more. Now I invite Dr. Juman, Secretary IAP, for vote of thanks.
Hello, good evening all. Hope I am audible because there is some network issues at my end. I'm sorry for any inconvenience. So already time is it is too late, and I don't want to take much more time. However, before going to my responsibility, I would like to congratulate our leader, National President-elect Dr. Ramesh Kumar sir and Venugopal sir for their great achievements. And my responsibility, I would like to thank Dr. Susan Mary Zakaria and Dr. Maya Bose for their excellent, very informative, simple, very informative presentation. Both of you presented and very well. It was very clear and very informative also. On behalf of IAP Malappuram, I would like to express our sincere thanks and gratitude to both of you. I also thank to all the state leaders, state presidents, state secretary, Pishadi sir, and Krishna sir, and all others who participated in this program, and all senior members and colleagues for who attended this program. And once again, I thank you all. Thank you and good night.